Has anybody ever on this entire panel seen a woman who was what we would consider a crazy bitch stop being a crazy bitch after she went to therapy, even once, ever?
No.
No.
Well, hey, I actually agree. So hey guys, it's Daniel, licensed therapist. So the guys on the Whatever podcast say that being in therapy is a red flag. And this whole discussion is led by Andrew Wilson, who is known for being a fierce debater, but not exactly the kind and cuddly type. And I wouldn't want to be on the opposite side of him on a debate stage, but does he have the chops to go toe-to-toe with a pro in the area of mental health? Because this man makes some bold claims about therapy. Hey, let's find out.
Hot take, I think it's kind of a red flag if a woman's in therapy.
It is what it is.
Why is that?
I got two.
I mean, I suppose it's worse if she has mental health issues and she's not in therapy.
Yeah, that's worse.
But I suppose there's also women who don't have mental health issues but are just going to therapy because that's what the society is telling people to go do. Therapy is hip and cool, and
I feel like saying
work through
that,
your problems or whatever.
I feel like saying that it's a red flag for a woman to be in therapy.
Yeah, kind of is.
Half the reason that women won't go to therapy, and that's why they have so many mental problems. Yes, because why are we being judged? Why are we being judged for going to therapy? Like, that's a problem.
Hey, is therapy hip and cool? It's kind of nice when your profession is all of a sudden hip and cool. But is therapy a red flag? Well, I think it definitely could be. So I believe the success of a relationship is directly dependent on the mental health of the two individuals in that relationship. And if someone is in therapy, they are working on their mental health. And I firmly believe that it's probably best that people take care of their mental health before engaging in a relationship. So by doing the math, yes, therapy can be a red flag. So let's say someone is severely depressed, so depressed that they can't even get out of bed. Yeah, they probably shouldn't be in a relationship. But let's say you had self-esteem issues and you're in therapy and you're working through it to the extent that most of the stuff that you're working on has been dealt with and you are winding down in therapy. Would I say that it'd be a red flag for that person? Absolutely not. I think that person would be perfectly fine to get into a relationship with.
Good. I hope that there becomes a stigma based around therapy. Women will stop going. That's good. That's good.
Why
that we
is that
have
good?
Such a stigma.
But then if we don't go to therapy, you guys are gonna be like, oh, you're a crazy bitch. Like, go get help.
The therapy doesn't seem to solve that. Does it?
It
Therapy doesn't seem to solve the crazy status of women.
I guess it depends who you ask.
I actually think she brings up a pretty good point. What are crazy girls supposed to do? Are they just supposed to just be crazy? Are they supposed to just clench their fists and try to not be crazy? Therapy is, at the very least, an attempt at change, trying to not be crazy. Is it the magic bullet that's going to cure them of their craziness? I think we all know that it's not the magic bullet. And as a therapist, I'll be the first one to say that. But if therapy is not the solution, then what is the solution? If you have a better solution, I am all for it. Hey, look, I got into mental health because I just wanted to help people. And I thought that therapy was the best way to do that, to help people through their mental and emotional problems. And if there's a better way, I am open to it. But so far, no one gives us a better way. They just say therapy isn't the way. So let's see if they come up with something that can actually help people.
Wanted to ask, has anybody ever on this entire panel seen a woman who was what we would consider a crazy bitch stop being a crazy bitch after she went to therapy, even once, ever?
No.
No.
I want to say that Andrew's initial statement is anecdotal, but I would say more or less true. Because what are they talking about here? They're talking about some of the most serious mental disorders that we have. He is alluding to the cluster B personality disorders.
Oh man. Oh God. Oh man.
And when it comes to relationships, these are the big boys. We're talking about antisocial personality disorder. We're talking about narcissistic, histrionic, and the #1 relationship killer, borderline personality disorder. These guys can strike fear into the hearts of therapists. In fact, therapists constantly refer out when they come across a patient with one of these disorders. Coming up as a young therapist, it was borderline personality disorder that was the scariest for therapists. But for me, in my practice, if I were to come across someone with strong antisocial traits, I would refer out because I simply don't have the experience or expertise in dealing with such a serious condition. These disorders are extremely difficult to overcome, so having Andrew and these girls say that they haven't seen anyone go from crazy to not crazy, well, I don't dispute that.
No,
I think
not once. It's never happened in the history of all of sociology. It's never happened.
Okay,
Hold up. Wait a minute.
now this is a very big statement that Andrew is making here, and I want to give him the benefit of the doubt, and I don't think he's making a truth claim here. I think he's just saying something to be provocative for the podcast. And hey, it makes for very good content. But if he's being serious, it implies that Andrew has all the knowledge of all the outcomes of all the therapy that's ever been administered to a human being. And all we need is one case, one successful case that would nullify his statement and render it false. And well, let me tell you about a story of one of the first couples that I've seen in therapy. They were a very young couple and they came in before they were getting engaged and they wanted to work on their relationship. And well, it was an extremely tumultuous relationship. And I started to really see some serious borderline traits from the girl. And it was not easy at all for me or for them. There were plenty of tears that were shed. But you know what? I actually give her a ton of credit because we were able to develop a good relationship and she actually allowed me to challenge her in her way of thinking and the way that she approached things. She was very open to the input I would have and the suggestions that I would have. And guess what? Through the course of couples therapy, she actually got a lot better. At the end of therapy, she was able to regulate her own behavior. She was able to cut out a lot of the toxic things that she was doing. I know it wasn't a complete cure. There were things that she definitely had to think through, but she was able to engage in a trusting, committed, very good and beautiful relationship. And hey, maybe this isn't the norm, but it can happen. And the last I heard, they were actually happily married.
I think a lot of people, because I'm not really into therapy as well, I think a lot of people need to take personal responsibility.
Absolutely.
And deal with the harshness of it because...
But I feel like that's what therapy is for, so that you can...
Not really, because you have someone like sugarcoating like the problems.
I think so much of the therapy
and trying to
just,
put you guys on medications and stuff all the time.
I don't know what therapist you guys went to. I never had a therapist that tried to put me on no medication.
So it's become obvious to me that these people are complete morons and they have no idea what they're talking about.
No offense. No, none taken.
I am just kidding. But I do feel like they don't really know much about therapists. First of all, therapists cannot prescribe medication. We are not medical doctors, so no, we are not pushing meds on anybody. You can get meds from your therapist if they happen to be your doctor or a psychiatrist. Other than that, we cannot prescribe medication. Well, do therapists just sugarcoat problems and we're there to just perpetuate some kind of negative thought pattern that you may have? Well, I challenge you. Look at the different modalities of therapy. Do you see something in common? They are all actually predicated on change. People typically come into therapy because they're experiencing something that they want to change, and we are here to help them do that. Behaviorists change behavior. Cognitive behaviorists, they change thinking. DBT changes coping patterns. Psychodynamic changes your view of the past and the present. And narrative changes the narrative. Do therapists use empathy, validation, and positive regard? Absolutely. It is something that we use to develop our relationship and develop trust. But does that mean we're just sitting there candy coating things for people all day? Absolutely not.
Nickelodeon donated $100. Women go to therapy and are assigned drugs they don't need, so therapists get kickbacks.
Yeah.
Don't do it. If you hate what you do, stop. Then you don't need therapy. Mind-blowing idea, right?
I agree with the medication.
Just modify behavior.
Yeah.
Like how hard could it be, really, when you think about it?
I mean, that's like
to notate that getting together with guys who are interested in abusing you, domestic violence, and being an alcoholic at the same time while you're engaged in a basically online prostitution is a bad idea. Like, how hard could it possibly be to recognize these things? Why would you need a therapist to help guide you through this? I've never really understood that, honestly.
So Andrew says this here. I actually take it in very good faith. I do feel like Andrew is genuinely confused. He's like, why do this thing that you do? Why make these very poor decisions that you're making? And I get it, Andrew, but I think Andrew fails to understand that behavior is simply a result of a lot of stuff that goes on between the ears, in the mind. And if you don't have access to that or understand what is going on in the mind, behaviors are a mystery. Let me give you an example. Andrew himself, I see him smoking all the time. I'm sure he knows the research about smoking. I'm sure he knows that it's really bad for him. I'm sure he feels the negative effects in his body. And I think he knows that the right thing to do for him and his health is to stop smoking, but yet he continues that behavior. And I'm sure there's a very good reason why he does that. Maybe physically he's addicted. Maybe mentally he's addicted. Maybe he uses it as a self-coping mechanism. Maybe he has so little self-worth in himself that he's smoking himself to death. What is it? I don't exactly know, but I know that there is a reason. And people do stuff all the time that they know they shouldn't do, and they don't do the things that they know they should do. I think practically everybody has that problem. And I would just caution people to judge other people on their behavior. Because what I think Andrew is doing is he's seeking an area of his own strength, relationships. I've seen his wife and it seems like they have a really good relationship. So he takes this strength and he projects it on other people and say, why can't you be strong in this area? But just because you're strong in an area doesn't mean that everyone else is. Let's keep going.
So my therapy isn't for my boyfriends. It's for childhood trauma. It's for way deeper than men me. So I have a reason to go to therapy, not just because I've had bad boyfriends. That's fine.
I'm just saying it's a red flag.
It's a red flag, but
if somebody isn't there,
some things you can't just talk about within yourself, unfortunately, and understand within yourself.
It's like, why are they in therapy?
Maybe some things need to be explained on a deeper level to some people, and that's what the therapist is there for, to explain this and why you went through this, and maybe how to get through what you went through or change what you went through.
Yeah, but there's look, if perhaps, for example, I think one scenario where I'm totally fine with therapy, if there was like your parents died or someone you love died, and you wanted to find out strategies of how to cope with, there's therapists that will specialize in that, or there's therapists you can go to that can like really, if there's something specific, but there's people who are just like chronically in therapy just to go and kind of complain and whine.
That's what I don't agree with that. I feel like therapy is definitely a thing for people who have like childhood trauma, any type of trauma. But I don't feel that going to therapy just to complain is therapy. That's not therapy.
So here's where the ignorance really gets dialed up a notch. I think these people don't really know what therapy is. They have this concept in their mind. They know it's two people in a room talking, and from that, they just try and formulate what it is. And what they come up with is it's complaining and someone validating that complaining. And Our Lady in Pink here says that's not what it is. And well, she's exactly right. That's not what it is. And she's also right when she says that therapy is there to help people process and understand something on a deeper level so that they are able to make that positive change that needs to happen. And Brian makes a good point when he validates therapy and sees a utility of it being able to help people in certain life circumstances. So I really do appreciate that. But to say that it's just complaining is a bit of a misnomer.
Go ahead really quick.
Regardless, I think if you do attend therapy, there needs to be a means to an end. It's not just a constant rambling session to just waste your money every
There should
week.
be like a beginning,
you need an end date, like an end day, end goal.
Yeah.
So like a therapy
by
end
this
date,
point, you should know what you've gone through and how to
and
I cope with it. How to deal with
I
it
completely agree that like if you went through some sort of traumatic experience and you feel the need to talk to a professional about it, that's completely fine. But there are plenty of people that have self-diagnosed themselves as having some sort of mental incapability or whatever it may be, and they are in therapy for it. And essentially what they do is they just rant about their problems and talk about their day, and their therapist just sits there and
takes their money,
gets the money for
exactly,
it.
Exactly.
So I agree to this to an extent, because this is an ethical question here. And I feel like a lot of people have this question. Do therapists just take people's money? Do they just not care? They sit there and listen to them, and they're basically taking advantage of people. And you know what? I am absolutely positive that yes, this does happen. But you know what? It is unethical. In therapy, when a goal is reached, I check in with the client and I say, hey, this is where we've come. We've achieved this goal. We reflect back at the beginning what they were going through, and we walk through the whole progress to see the whole arc. And I say, it's completed. This therapy arc is done. And what I do is I leave the option of them being able to come to therapy just to have a place to talk if they want to. But I do make it clear that they are done with therapy and they don't need to come back if they don't want to. And I do try to make it very clear at the beginning when we first start therapy that the goal of therapy is to get them out of therapy as fast as possible. And yes, I absolutely believe that there should be a goal. Should there be an end date given? Well, I would say that that's very difficult to give them a date, but there should be some kind of plan. There should be some kind of description of what therapy should look like. At the end of our initial consultations, I usually tell clients how I think I can help them. And within that initial sessions or the first few sessions, there should be a list of symptoms, of dysfunctional behaviors, of negative thought patterns or relationship patterns, or something that should be measurable that the therapist is working to reduce. And we do our best to try to measure it out. These symptoms we want to reduce in duration, we want to reduce in intensity, and we want to reduce those in frequency. So obviously I think therapy can be tremendously helpful. I think it'd be great if we all were able to process and chew on our thoughts and really come out with a way to sort things out. But I think that leads to our question, is therapy a red flag? Well, push comes to shove, I would say yes. Therapy is a red flag because it is someone working on a mental, emotional problem. But you know what I say to you people in therapy right now? Focus on therapy. Focus on your process, put in the work and get better. And once you're done and once you're out, it's green flags all the way. Well, that's my thoughts on therapy. Do you agree, disagree? I would love to hear it in the comments down there. And if you like this type of content, I would ask you to consider liking and subscribing because it will make you a better person. And if you have anything you want me to react to, leave it in the comments down there. I appreciate you watching. You are amazing. I'll see you next time.